Just put a
Yeah.
slideshow.
Oh, okay. So, thank you very much for this kind invitation and for these controversies. That is open lumbar spine surgery versus minimal invasive surgery. Sorry, if it doesn't. Okay, this is my conflict of interest. Defending the old in face of the new is not easy. So thank you very much, Salman, for this opportunity and this hard talk. But it's important not to confuse what is new with what is better simply because it's new. This is a key point. We have seen in the other presentation regarding minimal invasive surgery in different talks that minimal invasive grants reduction in approach-related morbidity, reduction of complication, surgical time, blood loss, and improve of cosmesis. So there is very big expectation in this kind of surgery. But what is the results in this paper? But be careful is. Was published in 2014. The differences between the lumbar disc herniation treated between open surgery with minimal invasive surgery didn't show very good results, and there is just a lower risk of surgical site infection in favor of minimal invasive. For disc herniation, cervical or lumbar spine, there is 4 cervical trial and 10 in lumbar spine, but there is no significant results respect to the two techniques. Sorry. The results change when we analyze the posterior lumbar fusion, and we found that there is a significant less blood loss, there is less back pain in the postoperative days, there is a reduced time to return to work, so there is better short-term results in favor of minimal invasive fusion. But what are the new results? Because as I mentioned, that result was for a paper before 2015. And again, new paper show that minimally invasive sleeve is associated with better VAS, better HODI, and again, there is less blood loss. And this is a very nice paper, very recent from 2024, where really Kim, Sang-Min Park, and Young Jong Kim underline that minimally invasive right now is a good option and allow a reduced tissue trauma and faster recovery. The technological advancement, such the intraoperative navigation, robotics we have seen before, Corina presentation, and augmented reality produce better results for the minimal invasive procedure. And again, the clinical evidence support the efficacy, safety, and the cost effectiveness of minimal invasive respect the open surgery. So, open surgery is really the devil right now, or there is again a role for the open surgery. And if we have to underline this aspect, so we have to consider when MIS is not the best approach, some economic consideration. We know very well this picture from a heart paper, and we know that the MIS benefit zone is between a middle complexity surgery, while the very complex cases have equal or is a little bit better for open surgery. So, in case of cardiac venous syndrome, multi-level lumbar stenosis, very complex fracture, severe deformity, and infection, maybe the open surgery may have a role just for safety. Regarding the economic consideration, we have seen that from the hospital point of view, a minimal invasive seems a very good option, but we have to consider that we have a specific equipment. We need technology like navigation, robotics that have an initial high cost, so we have to consider this aspect. And other things that Mehdi underlined that there is a long surgical time to obtain a good learning curve. So that it means longer surgery and less proficiency at the beginning. And why? Another thing is that interoperative complication may need open conversion. It's very it's very difficult to define the rate of conversion in literature because it is mentioned, but there is no results, clear results. And finally, a revision surgery like screw displacement, junctional pathology, and cage subsidence can be very difficult to treat with minimal invasive, especially at the beginning. In this chapter of book proposed by Mehmet Zileli, they underline the disadvantages of a minimal invasive surgery that are in the steep learning curve, the initial technical equipment, the high costs, and the dosage. But we have to keep in mind that open surgery is an essential step for the learning process because with the open spinal surgery we use cadaver lab, we understand better the anatomy, and then we can obtain a good proficiency and move from minimal invasive. And we have to consider also that the navigation and the new technology reduce also the invasiveness of open surgery, so we are moving respect a less invasive surgery. So, approaching the spine through a keyhole, we have a partial visualization of the reality of our anatomy, but sometimes it's better to have a panoramic view of the reality. And just to conclude, I think it's essential that the patient and the case selection is a fundamental to choose between a pure minimal invasive surgery, open surgery, or a combine a minimal invasive approach with a mini open approach. Thank you very much for your kind attention.